your quality of life is getting a little better. Smarter Heart University and Dr. Scott on AM 970, The Apple.
Welcome back to your Smarter Heart University, your institution for higher heart learning without all the headaches. Again, callers, 866-970-9622, 866-970-9622. Answer to pop quiz number 1. To avoid high blood pressure, which has the greatest impact in women, dieting, 30 minutes of exercise, losing weight, having your BMI less than 25, or moderate alcohol consumption. Well, the key answer is all of them have a big impact on decreasing your risk, but the most powerful is losing your body mass index, lowering your weight. Why? Because women actually have a higher obesity rate than men. Women tend to be more sedentary than men, especially in bad weather. Fact. And what's interesting is once the good weather comes, they're less likely to get motivated to get back out there and exercise and do the right things. Again, the same thing as in stress, the barrier when polled, children and family pressure. Why is this bad? Well, one of the reasons why stress tests fail is because women fail to reach their maximum exercise tolerance. You're the expert on this, and we'll talk about that in the diagnosis. So the less active and less maximally exercising that a woman is doing is much worse for women than men. 5 times more mortality with a worse exercise tolerance in a woman, only 3 times more mortality in a man. So get out there, women. Just do it, as the Nike commercial says. On to topic 2, presenting with a heart attack. This is where we like to say our famous tag, men die suddenly, women like to drag the issue out. And this is not an insult. This is a fact. Why? Not your fault, actually. Number 1, there's lower use of testing and medicines in women with heart disease. Mm-hmm. Number 2, there's less ability to identify women at risk for events. Number 3, women delay in presenting with these symptoms, and mainly because there's a sex difference with the symptoms. Why? Okay, anatomically, women have smaller arteries and more diffuse blockages. It's a big fact. We'll talk a little bit about the anatomy again. Women have more symptoms on exertion than men do, or with stress. While men complain more, this is something they said, so yes, we can insult ourselves here. Men complain more, women tend not to complain more. Women have something called microvascular angina. What is this? Well, if your 3 major arteries are the Atlantic, the Pacific, and the Indian Ocean, as I tell patients, the oceans go into rivers, rivers go into streams. What if somebody were to drop a whole bunch of bricks and rocks out in the streams and kind of put a dam up there? Well, eventually it feeds back into the rivers and feeds back into the oceans. This is how symptoms develop outside. So this dysfunction of the smaller branches outside the main ones causes a chest pain that we don't see on EKGs and stress tests and even angiograms. And we're going to talk about that in the next segment in detail. Also, lack of hormones. When your estrogen drops and your cholesterol increases and the clotting factors increase, all of these things lead to the sex difference in symptoms. Does that surprise you at all?
It does and it doesn't. I mean, we know from being in with patients that women have a different set of symptoms than men. There's been study after study that shows that women present later in the disease process, when they do present, don't get as much aggressive intervention as men do, and as a consequence tend to do worse.
Yeah.
It's unfortunate because it shouldn't have to happen that way. We should recognize as physicians that women are a different animal.
Right. Well, again, so this is dragging the issue out. The prodrome, as it's called in the literature. Atypical chest pain should be stricken. And you brought this up to one of our other lectures. Atypical chest pain should be stricken from the record. Female pattern of angina has been much proposed. Yes. But most doctors, as we said the last segment, continue to consider chest pain as the most important symptom for a heart attack diagnosis for both men and women. But in 2003, this was the beginning of a change. They were found wrong. 90% of women were found up to 6 months before their heart attack to have the following. 71% had extreme tiredness and fatigue. 48% had sleep disturbances. 42% had shortness of breath. 39% had indigestion, heartburn. 36% had anxiety. 27%, less than 30%, had chest pain. Now, while some women ignored these symptoms, others repeatedly sought medical assistance from this study. Now, I'm not making this up, only to have doctors minimize, misdiagnose, and ignore these symptoms. Now, I'm sure over the past 7 years we've improved upon this, but what's really interesting is if they ignored the symptoms acutely, they then got the following leading to their heart attack. Again, is chest pain high? No. Shortness of breath, almost 60%, 58%. Weakness, 55%. Tiredness, 43%. Sweats and dizziness, about 40%. So when we were talking about, as we were talking about in Recognizing Heart Attack show that we did, both Dr. Kaiser and I concluded that any noticeable change in how you feel is a red flag. If you're waiting for the elephant to come sit on your, I'm going to say this every show. If you're waiting for an elephant to come sit on your chest, keep waiting till they're digging the proverbial hole in the ground. Now we have a caller, but I just want to make a statement. The treatment, women, number one, present much later after the symptoms start. They wait longer for treatment to be started. They are less likely to be admitted to the intensive care unit once they come in. They're less likely to receive invasive therapies from us, like stents or bypass from the surgeons. Therefore, and I conclude this segment, there is a greater need to educate healthcare professionals to look for the correct diagnosis, number one, look for it earlier, number two, treat it earlier, number three, and treat it correctly. We have a caller, Marion of Waretown. You're on the line. Marion? Well,
guess not.
Guess not. Marion, are you there? Oh, I'm sorry. Bob, do you want to make a comment about this treatment approach?
I think it's correct. I just had a patient a few weeks ago who came in, and her only symptom was shortness of breath, and she had been treated for months for a potential chemical exposure. And after all the therapies didn't work, her physician, a pulmonologist, actually referred her to me for further evaluation, and it turned out she had a severe blockage in the main artery in the front of her heart. I fixed it, saw her back a week later, and she said she hasn't felt this good in years. Years she's been treated like
Marion,
this.
are you on the line?
Yes, I am.
Oh, great. We just had a little...
I heard what he was saying, but I'm just interested in leaky heart valves. What can you do to help that? You know, I know you said you could live a normal life, but in the long run, does it have to be operated on, or?
Leaky heart valves now? We're talking about heart disease. Blocked arteries or a leaky valve?
A leaky valve.
Okay. Well, different topic. When you're talking about heart valves, it really depends on how bad it's leaking, okay. And number one, and number two, what your symptoms are. We look at things about the function of the heart muscle, how weak it is, how you present in terms of your symptoms. That's going to be a little bit different. We're talking about women who get heart disease, come in with chest pain, or in this case, other symptoms,
right.
And why women get the disease and how different it is from how men get disease. But valves are pretty much the same. So when women get leaky heart valves and men get leaky heart valves, we pretty much present. We look at you individually. We take each person. And individually, we look at those criteria that I just said, and then we make an educated decision about when to replace or repair the valve as such.
Which is different than a blockage of the heart artery.
Right.
A blockage can be fixed. Well, we are going to have a show on valve surgery without the surgery. So, Marion, you kind of led into that. We will have a special guest and talk about these new percutaneous going through the groin and being able to repair valves as such. Let me Marion. Thank you for your call.
Thank you very much.
Pop quiz number 2. At what age does a healthy woman best get protected from taking an aspirin a day? 35, 45, or 65 years of age on your Smarter Heart University.